new episode of the interview session. Today we are having the guest from the academician, but she is from the South Africa Rhodes University. So we welcome you, ma'am, in our interview session. This interview session is basically we take the pharmacy profession or the medical profession people. So, ma'am, how was your journey you have begun in the pharmacy career?
The pharmacy career, when I started my journey, I started studying in 1988, where I had not seen any pharmacist other than the person who takes a prescription and gives you the medicine. So the first comment that I received in the family was, why are you doing a compounder's course if you consider yourself so intelligent? So that was the first point in my life where I decided that I may be doing what is considered a compounder's course, but I'm not going to be a compounder. And just to put it as a pun, I've never sat on the wall. I know which side of the fence I belong to and I go to that side of the fence. So pharmacy, when I started, did not have the perceptions of public health. Pharmacy in India was only to do with industrial pharmacy. And pharmacy, the way I see it now, was not how I started. So the journey has been a constant evolutionary process in my own head and heart, where from an industry focus, I have moved into the community engagement focus. And that is in line with what is happening, whether you look at the UNESCO program or you look at the TALWA network, which is one of the globally acknowledged groups for community engaged research. That is where the world is working towards. So I just happened to be at the right place at the right time for different reasons. And going from an industry, I have moved completely towards community and public health aspects of pharmacy. And that has been my evolution in the area of pharmacy.
That's really nice, ma'am. So how was this journey? Means you have started your career in bachelor of pharmacy in the India. So currently in the South Africa, you are in the Rhodes University as a visiting faculty. So what made you to take in that position in that level?
See, the journey for everybody's life is one dot connects to the next dot. So when I looked back at 1988, I had no clue I'd be sitting here and doing this interview and talking about what I've done. So if I look at where it went and how it has been proceeding, each step and each person in your life supports you to go from one point to the next point. It's a ladder that you climb. And in that ladder, from masters, it was evolution into going into the pharmacy practice. And being the first person in the area of pharmacy practice, understanding was not an easy aspect. But what helped a lot in that journey was the link to the World Health Organization. Because when I was working for the Pharmacy Council, accidental emails I had sent to several people took me to Dr. Ranjit Roy Chaudhary, who was the president of Delhi Society for Promotion of Rational Use of Medicines. So when you meet the right mentors, they give you the tools for you to move forward to the next step. So I was appointed as the technical coordinator for the Karnataka program. So I started that program. As a part of starting that program, I had the advantages of being trained by the World Health Organization. So I've undergone 3 massive, intensive programs, which is on drug policy issues in developing countries, Pharmacy and Therapeutics Committee, and the last one was on promoting rational use of drugs in the community. So between those
This is happening in that time only.
Yeah. All this was everything. All my growth was in India till 2002, and all this happened between 1999 to 2002. And I started my career in the Drug Information Center, and there I have to give complete credit to my husband, who has been one of the most important mentors of my life. Because I was supposed to go and become a lecturer, because that is what I had started my career. That's where I had started my career. So instead of going to a college which was just a few streets away from the Pharmacy Council, this was an opportunity that came up to work in the first Drug Information Center, which was open to anyone in the country. And at that time, no one could tell me where my career would take me. So at that time, I was not ready to take that risk. So thanks to my husband, who said, no, it is a good challenge, take that. So that was a very powerful sentence. And that sentence is where I now look back with a great sense of pride. Because you have to have people who give you the confidence to move forward. You have to have people who support you to go through that journey, where when you have to work 8 to 12 hours a day, when you have to manage your family and your young child as well, if you don't have that support in the house, you will collapse. So each person has played a critical role in some of those journeys, and that is where, from the WHO program, then I got the opportunity to be appointed as an associate professor at Rhodes University. And then I served Rhodes University for 13 years, and then I went for the promotion for a full professor. And that is how 14 years happened at Rhodes. And now that I have moved back to India, I have taken on the collaborative space where Rhodes has offered me the visiting professorship, so that it will help me allow my students to complete their masters with me, and also it will give me opportunities for students from Bangalore to look at research opportunities and mentorship opportunities at Rhodes. So that has been the bigger picture of that journey.
And like you said, like your husband is also from the pharmacy professor.
Also from pharmacy profession.
Okay, so when in between the marriage takes place in your life?
Well, we met when we were studying. I started the first year of pharmacy in 1988, and he was a second year pharmacy student in PS College of Pharmacy.
Okay,
So
in PS College in that time. Okay, okay.
So we met there, and then 1994 we got married.
Okay.
And then I went on to do my masters. We have taken turns in studying.
Okay.
Because one person has to earn while the other is studying. So,
so it was a love story.
Of course, it is.
Love marriage.
It is definitely love marriage. Yes, if you want to define it that way. But it is a very sustainable relationship.
Okay.
Because when you go through the ups and downs of life, things tear you apart. So there has to be something that keeps it going. And respect for each other is what keeps things going.
So in respect to talk about the respect, in the house you are the boss or the son is the house?
We take turns to be the boss depending on who is good at what.
Okay.
Because we have different strengths. Yes. Whatever he is very good at, fortunately, I'm not good at those things. Okay. So there is no competition.
Okay.
So as long as you can recognize the competition and keep it at its base, there is no need about who is the boss, because at the end of the day, a family functions only when there is space for everyone. It is not about who decides. It has to be for the good of the house rather than the good of the person.
Ma'am, like in your 90s you have started, in early 80s you have started your career in pharmacy. And in that time there was only diploma, bachelor in pharmacy, masters there, and afterwards some PhD is there. So now the family concept has been came. So how you see this overall this family concept in the today's medical revolutionary thing?
See, fortunately, I got the first global fellowship under the Pharma Bridge program, which is from FIP, the International Federation of Pharmacists. So in the year 2002, I was fortunate to be trained as the first global recipient of that. So for 4 weeks, I was in St. Louis College of Pharmacy, and for 4 weeks in Wisconsin Hospital in the US. So in St. Louis College of Pharmacy, I shadowed the academics to understand how the curriculum is set, how the course is taught, how it is happening in the community pharmacy, how the preceptorship program works. And one of the key things I picked up there was also the drugs and therapeutics committee, how that works in the hospitals. And then for the 4 weeks that I spent in Wisconsin, it was to shadow the pharmacists on the wards to understand what is happening and how it is happening. And this is a program that started more than 5 decades ago. So in 5 decades, improvements happen. You can't go from step 1 to step 100 in one step. It can't happen overnight. You may have all the know-how, you may have all the technology, but still you can't jump steps because knowledge comes only with time. Okay. We have all the information, but converting information to knowledge takes time. So after coming back from the program, I worked with the Alumni College of Pharmacy because the Vice President of Pharmacy Council was the principal of Alumni College. And I wrote the first proposal where KSPC, Pharmacy Council, and Alumni College would have a partnership to start the pharmacy practice for MPharm in Victoria Hospital in Bangalore. Okay. So from that stage, I have seen the evolution which came out of my training in the US, which came out of the first fellowship in the Pharma Bridge. And from that proposal and the dream and the objectives of what needs to be achieved in pharmacy practice, I have come a long way in this because that started in 2002. So from 2002 to 2017, I have been a part of this. And I was a visiting faculty from Pharmacy Council to the Alumni group in Victoria Hospital in teaching hospital pharmacy. and teaching the areas where I had the strength because I had been trained by the WHO and I was working for the WHO program. So that is the revolution that has been an evolution, and I have been a part of that evolution from its genesis.
Kripanidhi College of Pharmacy is one of the oldest pharmacy colleges in Karnataka. As a dedicated educator, the semblance of academics with a global perspective can be summed up as the Kripanidhi College of Pharmacy.
They build us with confidence so that we can do seminars, various case presentations, and they conduct many outreach programs.
Here the student pharmacist studies the chemistry of drug, their origin, procedures of drug development, their preparation, dispensing, their effects, and the eventual use for prevention and treatment of disease, and home to 18 highly equipped and advanced laboratories. Kripanidhi has tied up with MVJ Medical College and Research Hospital for the PharmD course.
Phase 1, how you see the doctor of pharmacy, MBBS is there, MDs are there. One therapeutic drug monitoring team is there, where the one MBBS, MD, or you can say physician, one pharmacist, one nursing, the whole team setup will be there in the international the healthcare system. How you see that particular thing implementing in the India?
What we need in India is much more than what we have, because the reason is very simple. Majority of the people don't have a health insurance, and we are not putting a lot of energy into preventive aspects of health. And with the epidemic level of increase in non-communicable diseases, we are literally inviting diseases because we are eating food that is high in salt, fat, and sugar. We are being physically inactive. We should be standing and doing this interview, but we are sitting instead, and we are becoming big consumers of alcohol and tobacco.
Yeah.
So these are the 4 key trigger factors that the WHO is trying to push, which if we can bring in more advocacy, then prevention can start. Now going back to the point of everyone has a role in that interdisciplinary team. So as PharmDs and future healthcare professionals, you have stepped out of the boundaries of the old industry-focused pharmacy or the disease drug dispense pharmacist. You have now stepped into the real world of public health. And public health starts from policies. So you have the ability to work in areas of health policy of your country. You have the ability to work in the hospital setup where along with the doctors, you're working shoulder to shoulder as part of a collaborative team. But at the end of the day, we also have to realize that because we don't have sufficiently trained PharmDs already who are, let's say, 20 to 30 years of experience, who are teaching the next generation, we don't have that. But that's how every country started. In the US, they didn't start because they had somebody who had 30 years of experience. They started the program knowing that 30 years down the line, that is where the profession will go. So we are in the right place at the right time. And we cannot become a US. We should not. We should not even bother to try that. For the Indian situation, we should look at what are our healthcare challenges. What are the niche areas where a pharmacist can contribute to the healthcare system? What are the areas where you're not actually stepping on the toes of anyone in order to contribute? Because at the end of the day, everyone does everything for the patient at the center. It is a patient care profession. It is for the population. It is not just the individual patient. You also have to look at public health, which is a population. So from a single patient to a full population, there is enough scope for everyone without actually feeling that you are threatening anyone, or without feeling uncomfortable that you know less than another person, because a medical doctor has his or her own strengths. So we are not trying to compete to become a doctor. Definitely not. We are collaborating to make it an interdisciplinary team for the benefit of the patient and the population. So there is no competition. When there is no competition, there is only space to work together.
That's nice. So, ma'am, in upcoming days, how you see the different job opportunities for the PharmDs?
Sky is the limit.
Is the limit true?
Because you can work in National Department of Health. You can influence policies. You can work in centers of excellence for research. You can work in hospitals. You can work in retail pharmacies where you're not focusing on looking at prescriptions and dispensing, but you're focusing on the patient. And now that India is also, as part of every other low and middle income country, facing the epidemic increase of non-communicable diseases, there is no dearth of opportunity. We have to be sharp to see what are the niche areas where we contribute to the system, and then eventually it is going to fall into place.
Ma'am, like rightly you have talked about the tobacco and the smoking thing. The WHO, recent that update the FDA has also given that they are reducing the nicotine level in the cigarettes, so that can, because when that one smoker become start smoking from the 15 years, 16 years, some are from the kid one.
Yes.
So that's why they are reducing it now. So this is one of the good steps for the to save the adults from the. So how you think these things bother you?
See, if you want to be bothered about situations in life, there are too many. So you want to look at how do you contribute to that. For example, one of the projects I've started at Rhodes University as part of workplace health promotion talks about tobacco aspects.
Especially for that particular tobacco.
Especially for tobacco and especially for the low literate support staff of Rhodes University.
Okay.
So there is one project which is running on tobacco, one project which is on alcohol, one project which was finished on salt reduction, and another project which was finished on physical activity and heart health, heart promotion. Because those are the major challenges in South Africa as in any other low and middle income country. So these are the areas where as a pharmacist I have absolute freedom to contribute to public health. So I am not concerned about it. These are opportunities and these are not challenges only. Every challenge is an opportunity in disguise. I don't know who said it, but it's a wonderful quote. Because if you see it as a challenge and a concern, you are seeing a black spot in a white page.
Yes.
But if you see it as a white page, which has one little black spot, then you're seeing only the white page. So it is how we look at life.
Yes. Ma'am, at to in this conclude this conversation in the short and sweet way, what you will give the one a small message to the upcoming young budding pharmacists?
Don't be afraid to dream big. No dream will go unfulfilled. If you dedicate time and you put in your dedication with all your heart, things will fall into place. They may not fall into place the way you want it, but they will fall into place the way it should fall into place. So dream big and chase your dreams. And live your life. Live your life fully well, knowing that you can achieve what you want.
Finally, we are in our this conversation in the interview, and there is the one small section that is called as rapid fire. So there is only 3-4 questions. So you have to give the answer in the one line. Okay. So here we begin with our rapid fire round. So today we are having a conversation with Professor Dr. Sunitha ma'am. She is from the South Africa Rhodes University as a visiting faculty. So ma'am, in this following category, if you will be in this position, what you will make the changes in the India, or we can say in the society, if you wake up as a health minister?
If I wake up as a health minister, the first thing that I would do is the collaboration with the universities, because that is the training ground of students. So if all universities work towards the objectives, the health objectives of the national research program, then we are all contributing from different areas for the same reason. So working with the universities and working with healthcare professionals is the first thing that I would look at.
if you wake up as a Medical Council of India's president?
I will call the president of the Pharmacy Council of India for a meal and discuss how the Medical Council and the Pharmacy Council have to work together.
Okay, if you wake up as the Pharmacy Council of India president?
Then I will call the Medical Council of India's president for a meal and discuss how we have to work together.
The last one is if you wake up as an education minister.
I would love to do that. For me, it is about, as feminist and as sexist as this may sound, it is about the education of the girl child.
Okay.
Because every strong society is dependent on a strong mother. If you want a better society, you better have good mothers. And that is why Napoleon said, give me good mothers, I'll give you a good nation.
Yes.
So my first focus it is not about being anti-men. When I say pro-women, it does not mean anti-men. It just means creating a different space for women and girls so that they contribute to become a stronger part of the society. They are 50% of any country's population. Why are we leaving out that 50% and choosing a small segment to progress when that is where your family and your country is dependent? So I will focus on pro-girl child education.
Okay, and the worst thing in you?
My impatience. I can't keep waiting.
Another question, you have to rank these people according to in your thinking, how you see these people. One is health minister, another will be the Pharmacy Council of India president, another is the Medical Council of India president, and another is the education minister. You have to rank according to you.
In my head, I will just rank the first person because it doesn't mean the other three are less important.
Okay.
The first person for me is the education minister.
Okay.
Because when there is good, strong education, it gives you the first foundation for good health. A whole lot of diseases can be prevented if you're well educated. So I would put education first and health next.
Okay, ma'am. And these are the one animals are there. I'll give you one animal's name. These animals whom that give you the remember of, like a lion.
My husband is a Leo, so I see lion in my face every day.
Okay.
And I love the lion.
Okay. Tiger.
My husband calls me the tiger, so yeah, it reminds me of myself.
Okay. Elephant.
My son reminds me of an elephant.
Okay. Okay. The last question is, if you have to give the one message to Mr. PM Narendra Modi, what you will give?
I like the way he thinks outside the box. So I would compliment him for outside the box thinking.
To the Dr. B. Suresh, Pharmacy Council of India President.
Taking the future pharmacists into a higher zone based on what he is putting in there is a wonderful compliment, because the stronger the Pharmacy Council of India gets, the better and stronger the platform for the next generation of pharmacists. As educational people, our dreams are majorly achieved by our mentees who are our students.
And another one, to the Health Minister of the India.
We have several opportunities. It's time we see the common reasons to work together. That would be the first message, to bring everybody who needs to be together, especially the communities. Because as an individual and as a community, we all have a role for individual health as well as the community's health.
And the last one, ma'am, me, Kabindra Karna, what will you give the message?
Keep having these programs more and more, because the more voices you bring in, the more thoughts you bring in, because each person brings in a very different strength. And we can learn from every individual we meet in life. We just need to have that humility. So the message for you is, as the next generation of a healthcare professional and coming from a neighboring country, you are strengthening two countries with the work that you're doing. So take pride in what you do.
Thank you so much, ma'am. In the short time you have given us the time, and thank you so much for accepting this interview session. and I'm sure that my young budding pharmacists who are there, it will definitely motivate them also, and it will make them to rethink in their profession once again and go deep inside it. So thank you so much, man, for having here. Thank you so much, guys, for watching. Have a great day. Take care. Thank you, man. Namaste.
Thanks
And
a lot for
thank
this
you so much
opportunity.
for
Thanks.
coming, and it's just like thank you so much, man.